Hey, it's Dr. LaRoche and Kyle again. We're here for another Lakeside chat, but due to weather,
you can see
we went to Alaska this year because it's nice and cool in this picture compared to the jungle we're dealing with now. So, but we're going to talk today about something we still see quite frequently that can be really devastating for families and dogs is parvovirus.
Yep.
So, yeah.
Okay, so what is parvovirus?
Parvovirus is a non-encapsulated virus, which means it likes to live in the environment forever. It's difficult to kill, although bleach does kill it. And it affects puppies. It tends to be a disease of puppies, unvaccinated dogs, and it causes just tremendous vomiting and diarrhea. So
it's really sad.
Yeah, and they can, with supportive care, most of them will live with good quality supportive care, but there are some that succumb to it and do pass away.
So that kind of answers the how serious is parvo. It can be deadly serious.
Yes.
It's never not serious. It's never
Correct.
just something you can take for granted that he's going to come out of it or she's going to come out of it. Is it contagious to other animals, like dogs or cats?
Yeah, cats have their own parvovirus as well. They can, it's panleukopenia, so feline distemper is actually a parvovirus. But for the most part, it tends to be a unvaccinated dog disease. People don't get it. There's probably other parvoviruses in the world, but this is pretty specific to the dog species.
So how do dogs get parvo?
So it's in the environment. We call it ubiquitous. It's kind of everywhere. And you can track it around on your shoes, so it's in the ground, and dogs are sniffing and ingesting things, and they get it on, get it on their feet, lick it off their feet, eating things out in the environment. So it's transmitted oral fecal, so they ingest it and become infected with it.
And where you go can affect whether your dog gets parvo or not.
Right.
So you can walk your dog, but you can just go somewhere that's been exposed to parvo, pick it up, bring it home, and you will never know. So
that's right.
Hence the importance of vaccination. Is my dog at risk if we don't go to dog parks?
So if your dog is a fully vaccinated dog and has had all the recommended distemper parvo vaccinations, your dog is very low risk and can go to dog parks. Unvaccinated puppies and dogs that are unvaccinated are at higher risk because they don't have immunity to parvovirus. And so high dog concentration areas, may be a place where you're going to have more virus.
We've talked about places like rest areas. I would hope most groomers require a parvo vaccine.
So. Yeah, I would hope so.
Anywhere that you take your dog should require it, but a lot of people go to Tractor Supply and places like that, and you don't know where
that's right.
where those dogs have been and what they have. So can older dogs get parvo, or is it just puppies?
So for the most part, once most dogs have achieved a couple of years old, they've been around enough that they've had enough natural exposure, because parvovirus is everywhere, so they get little bits of exposure and they get kind of auto-vaccinated for it, so to speak. With that being said, I've had some 5 and 7-year-old dogs that have had parvo because they had such a limited environment where they were at, so they weren't exposed to anything, and then they got a big dose of it and then did develop parvovirus. And it's possible in some of the older patients that maybe a failing immune system might have something to do with that as well. So
can my dog get parvo if it's been vaccinated?
That is very, very unlikely. There are a few rare reported cases of kind of an aberrant strain that vaccine didn't cover, but those cases are extremely rare. For the most part, parvovirus is still a very preventable disease with vaccination.
Yeah, and the proper vaccination, not one here, one there,
That's right.
Month apart, 3 months apart, 2 weeks apart, 2 days apart. No.
Yeah. Puppies, we have a vaccination series for a reason. It's to stimulate their immune system for parvovirus until their own immune system kicks in, basically, and can protect them. And older patients as well that have no vaccine history, we do recommend a series for it. It's a highly protective vaccine, though, once they've had the series.
Yep. So what are the symptoms of parvo? You talked about vomiting and diarrhea.
Yeah, lack of appetite, vomiting and diarrhea. In some of the extreme cases, they can move pretty quickly into recumbency because they get so dehydrated. They become septic because basically what's happening with these puppies is the lining of their intestines is sloughing off, and so there's nothing to protect them from what's in the intestine, which is bad stuff, and they can become quite septic, and it can affect their central nervous system. It attacks very fast growing cells, which are the GI cells, some of the nervous system cells, bone marrow.
Yeah. So how quickly do the symptoms show up after they've been exposed?
Yeah, I think that's variant on the amount of parvovirus they get exposed to and what immune system they have kind of left to fight it. So anywhere from 4 to 14 days. So it just kind of depends on the individual.
That seems to be a lot of answers to a lot of things. It depends.
Yeah, it does.
Yep. How can I tell the difference between parvo and something else like an upset stomach or intestinal parasites?
For those dogs that have a questionable vaccine history in any capacity and they come in with vomiting, diarrhea, and not eating, that can mimic a lot of things, anywhere from foreign-bodied intestinal parasites. We'll test for it. So it's a patient-side test. We test feces for actual virus particle, and within 10 minutes we kind of have an answer.
Yep. Sure do. How is parvo diagnosed? And you kind of went through that. Yep. We do a snap test.
Yep. It's an ELISA test. Yep.
And we see little dots show up where it's not supposed to.
Yep.
We know we've got it.
That's right.
So you talked how long it takes to get the test results back, about 10 minutes. Can parvo be treated?
It can be. So there's a lot of available treatment. Most of it's supportive care. These patients are extremely dehydrated, so we rehydrate them. They're horribly nauseated, so we're trying to control their nausea. And then sometimes they're so nauseated they're almost painful. We cover them with an antibiotic, and also these are a lot of puppies, so a lot of them have comorbidity of parasites. So we're checking for intestinal parasites and treating for those concurrently as well. Now there's like a hyperimmune serum product out there that we can give these dogs IV to give them a little bit of a boost against their parvovirus too. It's not a substitute. It's expensive and it's really effective, but it's not a substitute for supportive care. They still need that supportive care.
So technically there is not necessarily a cure. It's all care, supportive care until they can fight it and get back on their own, right? So what does treatment involve? You talked about antibiotics.
Yep. Typically, we're going to recommend IV hospitalization, IV antibiotics. We're going to recommend aggressive nausea control. If I have clients that have the resources for it, hyperimmune serum. Unfortunately, it's not a financial reality for everybody to go through that treatment. Hence, the vaccines are really inexpensive. It's a disease you definitely want to prevent. We do some outpatient care where the owners try to give them fluids under the skin at home and do some supportive care at home. Survival prognosis decreases. When you decrease the care aggression, you decrease the survival prognosis too. So
how long does it take for a dog to recover from parvo?
It depends. Yeah, it depends. So I would say if they have if you have some dogs that have like some size to them, they have a normal white cell count. Their white cell count's not really low, and they just have some reserve. Those dogs a lot of times will do pretty well and kind of bounce back within a few days. Some of the high-risk patients are like the little toy breeds. They have no reserve, so they just don't have a lot to fight with. I feel like I tend to see a few more of those to come. They get hypoglycemia and some other things as well. But I've had, that being said, I've had some dogs that were hospitalized for like 10 days. It took them a long time to get through it and get past it. And these guys are so sick. They haven't eaten in so long. Sometimes they need feeding tubes and things like that to support them, just to kind of get them back on track. So it can be a real expensive and devastating treatment for sure.
Do they sometimes rally and then fall back?
They can.
We've seen that, haven't we?
Usually if they're eating and doing well for 12 to 24 hours, we kind of give them the okay to go home. Yeah.
Okay. What is the success rate of treatment? You said it's less if they take them home and treat them themselves.
Yeah, I would say if you take them home and treat yourself, you're looking at probably about a 50-50. And these are just kind of guesses. I would say in our hands, we would see probably 85% survival. And then if they have a really low white count, or, they're already hypoglycemic or low blood sugar when they come in, that prognosis goes way down.
Yeah.
And we have some prognostic indicators when those puppies come in.
So we can't save them all, but if you catch it in time, or catch it before it gets too bad, and your dog is in good shape to begin with to start, then they stand a better chance.
Yeah, definitely.
So, is treatment expensive? And you went through this, so basic is at least $500.
Yeah, I would say just with the testing and medications as an outpatient, I would say you're looking at $350 to $500. And I've had some puppies that I hospitalized that stayed for $600 or $700. Some of them
Plus.
up to $1,600, $2,000. It just depends on how long they need therapy, and how aggressive that therapy needs to be. So
you can't keep your dog inside all the time. How do I protect my dog from parvo?
Yeah, so puppies, when you get a puppy, we want good, credible vaccine history from a veterinarian. It's a good quality vaccine then, and it was administered properly. And so you want to administer vaccines in series. So we start at 6 weeks, and then we vaccinate every 2 weeks until they're 12 weeks, and then we do their last vaccine at 16 weeks. We see enough parvo in the area. We do the minimal vaccine interval, which is 2 weeks. Some clinics will do 3 weeks, and that just has to do with their protocol and what they see in their area, just to give these puppies a really good start. What's happening is puppies are born with an immune system from their mother to protect them, and it's wearing off anywhere from 6 weeks to 16 weeks, and we don't know when that's happening. So we're boostering.
No way to tell, is
No, there isn't. So we're trying to booster their own immune system to pick up as soon as possible when mom's immunity wears off. And then you get those poor puppies where their mom didn't really have much of an immunity, and that can be really hard because they can be pretty susceptible pretty young. So,
and something else we'd recommend is if you get it. Your puppy from a breeder or from a backyard breeder or just from your friend or whatever, if they say they're vaccinated, don't take their word for it. Unless they have veterinary records to back that up, bring them to your vet, get them vaccinated properly, because we see a lot of, my breeder said my pet was vaccinated. Probably not totally, but maybe they didn't explain that.
Right.
And so, go to your vet, make sure you're getting the care that you need for prevention. It's heartbreaking to see these guys.
Yeah, and if you have female dogs that you're breeding, you want to make sure they're properly vaccinated so they can pass on a good immunity to their offspring too.
So you talked about when you should get your puppy vaccinated. Booster shots are necessary.
Very much so.
One is not enough. What should I do if I think my dog was exposed to parvo?
If your animal is fully vaccinated, nothing. It's
nothing you can do. Really.
Nothing you can do, and they're probably protected. If they're unvaccinated, they could be incubating. There's nothing you can do, except for you can take that puppy in, get the vaccine series. I always caution people that you're not going to prevent that incubation from happening. So they can still break with parvo even though we vaccinated them. And studies aren't showing that any vaccine stress is going to hasten that or anything like that. So
that's good.
Yeah.
So how do I disinfect my yard or my house if there's parvo at my house?
So it is susceptible to bleach, usually 1 cap of bleach to a gallon. You can't really bleach your yard, so hence...
Or your sofa.
Right. So basically anything that you can bleach, that you can wash, that's what you want to do. You want to lower the amount of virus in your environment. If you have an animal with parvo, you want to kind of keep them isolated and wear gloves and try not to track it around. There's not much you can do for your yard, but just, picking up the feces and kind of decontaminating as best that you can, because you can't bleach your whole yard. And parvovirus is everywhere. You can track it around. You just want to decrease the load of virus in the area.
And at least lives for at least a year, does it not?
Oh, yeah.
If not longer?
Yeah, you don't know, but yeah, it's a long time.
So if your dog has it, be sure that there's a risk for another dog.
Yeah.
And if your dog doesn't have it, but your yard isn't fenced, another dog could go through it.
That's right.
Can coyotes and
I would think they would be a reservoir, sure.
Yeah, can walk through your yard. How how long does Parvo live in the environment? I kind of answered that question already. Long time.
Yeah, long time,
How long does it take before I can bring in another pet? Say I had a pet that had Parvo. How long should I wait before I bring in another pet in
We
there?
recommend like a year. Just disinfect if that's not possible. Disinfect the best you can. 6 months. Ideally, bringing a pet in that's fully vaccinated. So you can just wait for your puppy to be a little bit older, where it's had its full vaccine series, before you bring it into that environment to know it's got the best immunity it can have.
Yeah.
Because I've seen that again and again. Where multiple pets have broken because their environment was so contaminated. And so unvaccinated animals coming into that type of environment can be pretty devastating.
Well, and I mean, you think you're dealing with diarrhea, which is impossible to clean up out of your yard. Vomiting, which is also impossible to clean up out of your yard. A little easier to clean up in the house, but then it's just an awful disease to have to deal with. After my dog recovers from Parvo, can he infect other dogs?
So once they start eating and the diarrhea stops, shedding of this virus is very minimal typically, just to be safe, because there are a few outliers there. We recommend just kind of keep them limited for 2 weeks afterwards. But typically they're not shedding. Once they feel better and they're back to themselves, shedding is very minimal of the virus. Yeah.
And if there's a Parvo outbreak in your area, is it safe to walk your dog? Again.
Yes, if you've done all the right things for their health care, it should be safe to walk the dog. Yeah. And it's important that we do puppy socialization and things like that. We just have to use some common sense about where we take these puppies because they are compromised. So we maybe don't want to go to high dog traffic areas and things like that. Definitely don't take them to the shelter with you and, things like that. So
don't take them to the store.
Yeah, we want you to walk them, but you just kind of use some sense, and they can play with other dogs. Ideally, if they're vaccinated dogs, that's better. But
definitely.
Yeah, because it's important stuff. You want a good canine citizen as well, so.
Well, I think that covers the Parvo. We don't have our next one figured out yet.
To be continued. Hopefully we will be back outside. We've been inside a little more than usual this year because of crazy weather.
We had a lake one last time though. That was amazing.
And it's like 99 degrees out there anyway, so
and like 100% humidity, and it's we don't want our hair to get messed up.
That's it.
Well, thank you.
Until next time. See you later. All right. Bye.
I always wave over out of the thing, so it's backward when you're looking at yourself.